good morning, miss. How are you feeling today?
Hello, ma'am. Good morning. Uh, I don't feel fine because my hip is hurt.
I am Ofa and I am the nurse practitioner. So today I will ask something about yourself and your condition now. Are you okay with that?
Sure, ma'am.
May I know your full name? Okay, what are you, miss? And how old are you? Okay, and the last one, where do you live?
My name is Karen. I am 3 years old and I live with my parents.
Okay, thank you for your information. And now I would like to ask you a question. What are you feeling right now? Okay. May I see your hip? Okay. How about this pain? It is stinging just when I touch it, or it is stinging as always due to your activity?
Yeah, like I said before, ma'am, my left hip is hurt so much, so please be gentle, okay?
Okay. How about this area? Okay.
Yes, ma'am. That's where it hurt the most.
May I know how long did you get your hips pain?
It's from yesterday, ma'am.
Will you stretching your legs and your waist like you normally do?
I'm sorry, ma'am, but I don't think I can change my position because I will get hurt.
Did your symptom right now along with other symptom as well?
No, ma'am, I don't think so.
Okay, so then I will ask about some question about your medical history. I will ask you one by one. If anything you missed, you can ask me to repeat over again my question, okay? In 1 month or 3 weeks before, are you get any illness or you get some medical treatment or medicine?
Uh, yeah, I think 2 weeks ago I was in hospital because my respiratory infection.
Did you have any childhood illness?
No, no, ma'am.
How about your immunization status? Did you ever get any immunization?
Yes, ma'am. My parents always take me for immunization.
Then how about some allergies? Are you have some allergies or some problem with food?
No, ma'am, I'm not.
Are you on medical treatment right now?
No, ma'am, I'm not.
Have you been on hospitalized or get some serious illness before?
Yeah, like I said before, I was in hospital 2 weeks ago because my respiratory infection, ma'am.
Did you have some habits or the activity you usually do, like to bend down when you are sick?
No, ma'am, I'm not.
Did you have some habits or the activity you usually do, like to bend down when you are sick?
No, ma'am, I'm just sitting normally.
May I know if your family have any genetic illness?
Uh, yeah, I think my mom and my grandma is have an illness, but I don't think it's genetic.
In your opinion, is your environment good enough for you?
Yes, I love where I live.
Okay, thank you, miss. So then I will recording your vital signs. So you just sit down and relax because this procedure won't get any pain at all. So the first procedure is I would like to record your temperature body. So this is a thermometer. You can put it under your tongue. So I'm sorry, miss. Can I just open your mouth? Oh yes. Okay.
Okay.
your blood pressure is normal, and then I will get your blood pressure. I will measuring your blood pressure. So this is what will be uncomfortable. So you can just tell it's good done. Okay. I'm sorry.
Sure, ma'am.
Okay, thank you. And your blood pressure is normal. So this when I will counting your respiration rate. So this is a stethoscope. It will be put it on your chest. So you can just breathe normally. I'm sorry. Okay, take a deep breath.
Okay. It's done.
Okay, thank you. Okay, thank you, miss. Can you lend me your hand again? Okay. Okay, thank you. I will see your pulse now. I'm sorry, this is uncomfortable.
No problem.
Yes, thank you. Okay, thank you, miss. Could you lend your finger? Okay, the middle one is fine. Okay. Then I will check your oxygen saturation.
Sure.
Oxygen saturation is good. And this is the end of your vital sign checking. So the other one is your physical assessment. And you can just following me again. Okay, thank you for your cooperation, miss.
Excuse me, miss. My name is Maulida Litasari. You can call me Lita. Right now, I wanna do an inspection. May I check your head, please? Okay. Excuse me, miss. Your hair color is brown and it's short and thick. There is no dandruff on your scalp, no lice, no bumps, and no wound. Okay. Your head is fine. Thank you for your willingness. Uh, I hope you I hope you get very well soon, and I'm leaving now. Goodbye.
Good afternoon. Good afternoon. My name is Nurse Adzkia and I'm here to do a neurologic assessment. Can you please tell me your name, age and today's date, please?
My name is Crystal and I'm age 10 and today is 14 September 221.
Alright. Do you know where do you at right now?
In hospital room.
Yes, correct. So today I'm going to do a neurologic assessment. It's an assessment to determine a patient's neurologic function, and it allows localized for neurologic diseases, and it helps to ruling in or ruling out differential diagnosis. And this assessment will take around 5 to 10 minutes. I hope for your good cooperation so that this assessment will run smoothly. Do you have any question? Alright, so the first test is the olfactory nerves. So I want you to close your eyes and I will put something in front of your eyes. Can you smell it?
Yes.
Can you tell me what smell?
Panda paste.
Yes. Very good. And now we're going to test the optical nerve. For this nerve, we're going to test the peripheral visions by doing a confrontation visual field test. Now, can you please stand up in front of me? So I want you to cover up your right eyes with your hand. Like this, yes. And you look into my eyes and tell me how many fingers that I show you.
1, 3,
And now the opposite one. And tell me me the number.
1, 5.
Alright, good. And now we're going to test the cranial nerve number 3, 4, and 6. It's the oculomotor, trochlear, and abducens. Okay, so please keep your head still. Don't move your head. Look at this pen light. Follow this pen light with just your eyes. Alright, now please keep your head still and just look at this pen light too. Alright, now I'm going to check your pupils. Alright, very good. And now we're going to test the trigeminal nerve. I want you to clench your teeth like a bite down. Okay, can you please open your mouth? Very good. And now the facial nerve test. Can you please smile for me? Can you please puff your cheeks? Alright. And next is vestibulocochlear nerve. So I'm going to cover your opposite ear and I will say some like 2 words. If you hear it, you can tell me what you hear. Alright?
Watermelon.
Alright, so now the opposite.
Sunglasses.
Very good. Next is glossopharyngeal nerve. For this test, can you please say open your mouth? Alright, very good. And now is vagus nerve. Can you swelling down? Mainland. Alright, good. And now is the accessory nerve. Can you please move your head side to side? Another side. And now up and down. Very good. And the last one is hypoglossal nerve. Can you please stick out your tongue? Very good. Okay, so that's all for the cranial nerve assessment. Now we're going to test your patellar tendon reflex. Please sit down. Excuse me. Okay, so that's all for today's assessment. Thank you for your good cooperation. And for today's test, you showed an intact cranial nerve and a good patellar tendon reflex. Do you have any questions?
No.
Alright, if you have a complaint or your body don't feel good, you can call the nursing stations and in 30 minutes there will be a doctor come to visit and check up your condition. Okay, thank you for your good cooperations and I'm going to go out. Have a nice day. Excuse me.
First, mandibular examination technique, inspeksi and then palpation. Inspeksi for the swelling or redness in the facial area. Yang pertama kita melakukan inspeksi, kita mengobservasi dari area wajahnya apakah ada kemerahan atau ada benjolan. And then place a finger in front of the tragus in both ear and ask to the patient to open much. And then watch for the swelling or tenderness. Yang kedua, kita letakkan ibu jari di tragus dan minta pasien untuk membuka mulutnya dan kita amati apakah ada kemerahan, apakah ada benjolan. Nah, and then shoulder examination technique. Okay, and then shoulder examination technique. Nah, inspeksi the observation the shoulder for swelling, body deformity, and the positional abnormality. Nah, abduction, and then internal rotation, scapula, and then coracoid. Elbow examination technique. First, inspection elbow flexi and then extensi. and then check the counter of the elbow whether there is a swelling or not. And then palpasi the olecranon process, and then gently press the epicondyle. Not any displacement of the olecranon, and not any tenderness, swelling, or thickening. Embrace examination technique. The inspeksi, pay attention to the position of the moving hand to see if the moving is smooth and natural, and then note the presence of abnormality in the breast, hand, and finger bones. Observasi the contour of the palms, namely lateral and hypotenonal redness. Oke, yang pertama kita harus melihat dari posisi tangan saat pasien berjalan menuju ruangan, dan kita mengecek dari ini tangan dan jari tangan apakah normal atau tidak, dan kita harus melihat apakah ada bengkak, kemerahan, atau kerimutan. Oke, next palpation. Nah, palpation the radial styloid bone and snuff box anatomy. Ini kita tekan bagian sini, and then palpation the 5 metacarpal and proximal, middle, and distal phalanx. Sini, and then palpation the other area where to suspect abnormality, and then palpation the finger of swelling, bone enlargement. Okay, next spin examination technique. Inspeksi, observation the patient posture, and then when the patient is in upright position, the neck rotation. Take off the patient's shirt to see the back, and then the patient is asked to stand upright with the legs and arms hanging and the sides. Head should be in the middle of the leg, shoulder and hips should be parallel. Now, palpation, sitting position, palpasi, the spleen for tenderness, swelling, and bone deformity. Kita palpasi, kita tekan dengan halus apakah ada nyeri tekan, apakah ada deformity pada tulang, apakah ada benjolan pada tulang belakang. Okay, and then hip examination technique, pemeriksaan fisik pada pinggul. Nah, inspection, observation the patient get entering the room for floor weight, hip shift, and deflection. Now, observation the lumbar spine for slight lordosis, and the patient is supine determined in the symmetrical leg length. Check the alignment and contour of the nail. Observasi wide grip atrophy, look for swollen area. And then palpation, ask the patient to sit on the edge of the examination table with the nails flexed. In this position, the bones are more clearly visible, the muscle, tendon, and the ligament are more relaxed. Observasi for tenderness, lumps, and bone deformity. And then palpasi the medial and lateral joints of the tibioferomal joint with the nail. Okay, and then foot examination technique. The inspeksi, observasi all surface of the ankle, whether there are area of swelling or callus. And then palpation using thumbs, palpation the anterior part of each ankle joint for swelling, and then palpation the heel, especially the posterior and then inferior calcaneus and plantar fascia. Check for lumps and tenderness.
Okay, finally finished. Okay, thank you for your time.